Hello everyone. In this INR number 57, we are going to discuss a very important topic which came in all exams, especially NEET and INICT exam, and that is cerebellum and its anatomy. So what is cerebellar anatomy? So first we have to understand what will be the extent of cerebellum. So cerebellum is dorsally located and it will be ranging from the level of the pons at the base of the brain, right? So it is from the level of the pons to the base of the brain, and it will be weighing 150 grams, right? Now, if you divide them, we can divide them three categories: mediolaterally, rostrocaudally, and functionally. Right. So first, I will tell you about mediolaterally. Mediolaterally means medial part is called as vermis. So this is called vermis, which is a medial part, right? And the lateral part you are seeing is called as hemisphere, right? So mediolaterally, vermis is the central part and lateral part is hemisphere. Vermis is central, hemisphere is lateral part. Now see the rostrocaudally. Rostrocaudally we divide them into anterior lobe, posterior lobe and flocculonodular lobe. So this anterior lobe and posterior lobe is divided on the basis of primary fissure, number one. Then posterior lobe and flocculonodular lobe is divided on the basis of posterolateral fissure, right? So you can see primary fissure is dividing anterior posterior lobe, and posterior and flocculonodular lobe is divided by posterolateral fissure. So that is rostrocaudal part of the cerebellar anatomy. Functionally, we will divide them into three parts. And what are the three parts? Spinocerebellum, cerebrocerebellum, and vestibulocerebellum. Remember, spinocerebellum is a part which will contain vermis and paravermis area. Remember, it is vermis plus paravermis, which will be spinocerebellum. In the end, I will be describing this, right? And then the lateral part is called as cerebrocerebellum. What we have learned is lateral hemisphere is now called as cerebrocerebellum. And in the end, what we are seeing here is a flocculonodular lobe. So this flocculonodular lobe we are calling vestibulocerebellum. So these are three functional part of the cerebellum: is spinocerebellum, cerebellocerebellum, and vestibulocerebellum. Right? Now cerebellum is directly connected to which area of the brain? So now you can see this is the anatomy. Cerebellum is directly connected to midbrain, pons, and medulla. So these are the three important structures. So how cerebellum is getting attached to the midbrain directly with the help of cerebellar peduncles. So what are the cerebellar peduncles? Superior, middle, and inferior, right? So superior cerebellar peduncle is connecting it to the midbrain, right? Middle cerebellar peduncle is connecting it to the pons, and inferior is connecting it to the medulla, right? So midbrain, pons, and medulla, they are directly connecting to cerebellum. Midbrain is via superior peduncle, midbrain via superior peduncle, pons is via middle, and medulla is via inferior peduncle, right? In this, what we have to remember: superior peduncle is efferent type, middle peduncle is afferent type, and inferior peduncle is afferent type. So these are important point which I wanted to tell you about cerebellum and its connection via these cerebellar peduncles, which we will learn later on what is the use of especially this superior cerebellar peduncle. Now look at the cerebellum histology. When you are going to see the cerebellum histology, we will have two parts: outer cortical area and inner medullary area, right? So outer cortical area and internal or inner white matter will be there, right? So first we will focus on outer cortical area. Outer cortex has three layers. Remember, outer cortex has three layers. What are these layers? Molecular layers, Purkinje layers, and granular cell layer, right? So these are three layer: molecular, Purkinje, and granular. You can see in this diagram: molecular layer, then Purkinje layer, and then granular layer. Again, I repeat, listen to me very carefully. Outermost is molecular layer, right? Outermost is molecular layer in the cerebellar cortex. Then Purkinje layer will be coming, and the innermost will be the granular layer, right? So molecular layer, this was the question in AIMS. Which cell we will be seeing in the molecular layer? So molecular layer of the cerebellar cortex will be having two cells: basket cells and stellate cells. What are these two cells? So you can see molecular layer of the cerebellum, which cells are present? So there are two cells. One is stellate cell and another is basket cell. These were the question in the INICT exam, right? So please remember, molecular layer will be having basket and stellate cell, and Purkinje layer will be having only one cell, that is called as Purkinje cell. So middle is the Purkinje layer, Purkinje cell, and the innermost is granule cell layer. Granular layer will be having two cells, Golgi cells and granule cells. So granular cell layers are having granule and Golgi cells, right? Now what I wanted to say that these cells and their targets means where they have axonal termination, what are the transmitter they have, and what is their function, right? So first we look at the molecular layer. Molecular layer, what are the cells? Stellate cells and basket cell, right? What are their targets? So you can see Purkinje cell. So now you can see target is Purkinje cell. Their stellate cells and basket cells, they are both having axon termination at the Purkinje cell, right? And what are the neurotransmitter? So basket cell and stellate cell, because they are terminating on Purkinje cell, they will be using neurotransmitter GABA, and GABA will be making them inhibitory. So what I am saying that molecular layer, both cells are ending on the Purkinje cells. Their neurotransmitter is inhibitory GABA. Inhibitory GABA. That's all. Now coming to the Purkinje layer, they see this Purkinje cell is or Purkinje layer. Via Purkinje cell, they will go to the cerebellar nuclei. Later on, I will tell you what are the cerebellar nuclei. So they will go to the cerebellar nucleus, especially the dentate nucleus, which was the AIMS question also, right? So they will go to the cerebellar nuclei, and in cerebellar nuclei, they will release their inhibitory GABA only, right? Now come to the granule cell layer. Granule cell layer, you can see granule cells are there and Golgi cells are there, right? So in granule cells and Golgi cells, what is the importance? Granule cell, if you look at the granule cells, their axons are terminating on Purkinje cell. So granule cell is terminating on Purkinje cells. Neurotransmitter is glutamate, and they are excitatory. Remember, glutamate will excite, GABA will inhibit. This is one important thing we have to remember. Golgi cell, what they are doing? Golgi cells, they are going to granule cells. See, Golgi cells, they are combining with granule cell. These are the granule cells, right? These are the granule cells. So Golgi cells axons are terminating. See, Golgi cells axons are terminating on granule cell. Golgi on granule cell. Golgi on granule cell. And they will release GABA, and they are inhibitory. So now you can see three layers of the cerebellar cortex: molecular, Purkinje, and granular. And their cells also we had observed. Now I want to tell you two important points. If you look at all the cells in the cortex, they are all inhibitory except for the granule cell. Can you notice? This is the exam question. Granule cells are excitatory. Only granule cells are excitatory neuron in the cerebellum. This is the one point we have to remember. First important point we have to remember is the granule cell is the only excitatory neuron in the cerebellum. And another important point, Purkinje cells are the only outflow from the cerebellar cortex, right? So this Purkinje will be going to the cerebellar nuclei, and this is the only outflow. Otherwise, everything is input. See, here it is input. Here it is input via other cells, right? Granule cell is also input. Then Golgi cell is also input, basket cell is also input, right? All are input, but Purkinje cell is the only outflow from the cerebellar cortex. Granule cell is excitatory, otherwise all cells are inhibitory. You can see all cells are inhibitory except for granule cell. So these are the MCQ point we have to keep in your mind. See, this histological picture had been asked earlier in AIMS exam. They had marked the area and they have asked you to identify the layer of the cerebellar cortex, right? So this same thing which I had explained you, three layers. So outermost is the molecular layer, right? Outermost is the molecular layer where you will see basket and stellate cells. Then you are seeing this layer is Purkinje layer where we are seeing all these are Purkinje cells. All these pink cells we are seeing is the Purkinje cell, and this is Purkinje cell layer. And inside granularity we are seeing these are called granular cells. So molecular, Purkinje and granular layers are shown in this histological images. Now coming to the if you remember, I have said that Purkinje fibers, they will come to the deeper cerebellar nuclei. So cerebellum and its connection, we are going to see what are the deep cerebellar nuclei and what is their importance. So deep cerebellar nuclei, what they will do, they will process input. From where? From the cerebellar hemisphere, right? So their basic function is to process input from the cerebellar hemisphere, and then they will transmit the output signal. Now this is very important. So these deep cerebellar nuclei, they will transport the output signal through the superior cerebellar peduncle. So they will be transporting through the superior cerebellar. That is what I was telling you. Superior cerebellar peduncle. Through that, they will be transporting the signal. And who are the deep nuclei? If you look at the deeper nuclei from the medial to the lateral side, remember from medial to the lateral side. So we will remember this by a mnemonic called as fast, girl, exercise, daily. So this is a mnemonic to remember from medial to the lateral side. So what is that mnemonic? Fast is fastigial nuclei. G, girl, G is for globose. E is for emboliform. And D is for dentate. So these are four nuclei. Now you can see here, this is the cerebellar nuclei, right? And if I mark this as a medial side, right? And from medial, when you will move on to the lateral side, this will be the condition of nuclei. So who is the medial most? It is the fastigial. So you can see this is the fastigial, this is the medial nuclei, right? Fast, girl, exercise, daily, right? So GL, girl, is globose. So now you can see globose is after that. After that, emboliform, fast, girl, exercise. The emboliform is the third one, and then the dentate nucleus is the fourth one, right? So these are the four nuclei: fastigial, globose, emboliform, and dentate nuclei, right? So from medial to lateral, these are four things. What is nucleus interpositus, or also called as interposed nuclei? So interposed nuclei is a combination of these two nucleus, globose and emboliform. So globose and emboliform is called as interposed nuclei. So these are the deep cerebellar nuclei which will be receiving signal from the cerebellar hemisphere, and then they are transmitting output signal via superior cerebellar peduncles. Right now we will see the functional division. You remember in the beginning I said that functionally there are three parts: spinocerebellum, cerebrocerebellum, and vestibulocerebellum. So what is spinocerebellum? They will be consisting of vermis and intermediate hemisphere. So now you can see this is spinocerebellum, right? You can see this area is called as spinocerebellum, which contains vermis and paravermis area, which I have said in the beginning. So this paravermis area is called as intermediate hemisphere. So what is spinocerebellum? It is consisting of vermis. Now you can see this is the vermis and then intermediate hemisphere. So all these together, they are called as spinocerebellum. You understood? What is cerebrocerebellum? So this is cerebrocerebellum, which is the lateral parts, right? So cerebrocerebellum is lateral part. And what is vestibulocerebellum? Which is flocculonodular lobe, right? So vestibulocerebellum is a flocculonodular lobe, right? So now what I want to say that functional division of the cerebellum, their association with the nuclei, function, and their principal input. These are the three important points which examiner asks in exam, right? So now spinocerebellum, what are the nuclei you will present? See, this is the medial part. So they will be having medial nuclei. So what are the nuclei? Fastigial, interposed nuclei, which is consisting of globose and emboliform. So spinocerebellum, they have fastigial and interposed nuclei. Fastigial and interposed nuclei, and what is their function? Motor execution. So fastigial and interposed nuclei, what they will do? Fastigial nucleus will be sending signal to the medial descending system, and interposed nuclei will be sending into the lateral descending pathways. So these medial and lateral descending pathways from the fastigial and interposed nuclei, they will help in motor execution, means motor movement by the spinocerebellum, right? And their principal input, as you can see, the name itself is telling, is spinocerebellum. So spinal cord and cerebellar cortex, right? Cerebrocerebellum, lateral hemisphere. So you can see lateral hemisphere, which nucleus they have? Dentate. So they have dentate nucleus. What is the purpose of this dentate nucleus? Dentate nucleus will be sending output to the motor and premotor cortex of the cerebrum. So motor and premotor cortex, they will be doing the planning on coordination. So motor planning and coordination will be done by cerebrocerebellum. So cerebrocerebellum, what will be having the principal input for them? Cerebral cortex and inferior olivary nuclei, right? Cerebral cortex and inferior olivary nucleus will be the principal input for cerebrocerebellum. Then come to the vestibulocerebellum. Vestibulocerebellum, you can see this is the vestibulocerebellum, where you are seeing the flocculonodular lobe. So their nucleus, see, this will be having the medial most one. The fastigial nucleus will be present, and their output is to vestibular nuclei. Sorry, their input is to vestibular nuclei. So this vestibular nuclei will be helping in balance and eye movement. So fastigial nucleus function is balance and eye movement, and principal input will be the vestibular nuclei. It is input, not output. Vestibular input will be vestibular nuclei, and they will help in balance and eye movement. So that is why I wanted to check this functional division in the end, so that you can understand what are the functional division of the cerebellum, what are the nuclei involved in their function, and what are their functions. So now you understood. Spinocerebellum is for motor execution. Cerebrocerebellum is for planning and coordination. Vestibulocerebellum is for balance and eye movement, right? Now coming to the cerebellar circuit. If you look at the, see, already I have told you the histology, right? Molecular layer, Purkinje layer, and granular layer. Now we are seeing the output, only output of the cerebellar cortex. You remember that time I told you that only output to the cerebellar cortex is via Purkinje cell. And what is Purkinje axon? See this Purkinje axon. So Purkinje axon is inhibitory in the nature, because they have inhibitory GABAergic neurons, right? So this is the only output from the cerebellar circuit, and they will be projecting into the deeper, you remember that dentate nucleus of the cerebellar medulla. So that deeper layer will be having dentate nucleus. This was the question in AIMS exam. So please remember, this was the question. Purkinje fiber axons will be terminating or projecting to the which deeper nuclei of the cerebellum. So it is dentate nuclei, right? So remember this point. Fast girl, exercise daily, right? So the fourth one you can see here, which I was saying you, dentate nucleus. So this is the area where Purkinje neurons will be terminating, right? So now you understood. So this is what we have to understand about the only output, Purkinje cell, inhibitory GABAergic, inhibitory, and they will be going to cerebellar nuclei. Which cerebellar nuclei? Dentate nucleus, right? What are the inputs? There, remember, very simple. There are two inputs and both are excitatory. Remember, there are two inputs of the cerebellum, both are excitatory. What are these? Mossy fibers, climbing fiber. You can see there are two things, climbing fibers and mossy fibers. See that mossy fiber is also excitatory, climbing fiber is also excitatory to the cerebellar nuclei, right? So what is mossy fiber? They are having major input from all body part and cerebellar cortex, right? So mossy fiber is coming from having all input from the cerebral cortex and other part of the body, and they will be moving up, they will be combining with granule cells. So they are excitatory terminal. See, as I said, mossy, climbing, both are excitatory. So where they will terminate with the help of unipolar brush cell, they will be terminating on granule cell. So they are terminating on granule cells, and they are using glutamate because they are excitatory. Climbing fibers. So see, climbing fiber is arising from the, or they are from the inferior olivary nucleus, right? So climbing fiber is coming from inferior olivary nuclei, and they are having excitatory terminal on Purkinje cell. So now you can see climbing fiber is going here, and their excitatory terminal is on Purkinje cell. So this is what we are seeing. Both are excitatory, mossy and climbing fiber, right? Now we will see what are the signs of cerebellar dysfunction. Whenever we are having cerebellar lesion in our patient, we will be having disequilibrium. Dyssynergia means loss of coordination. Lesion of the hemisphere. Remember, if cerebellar hemisphere is affected, so extremities ataxia will be there. Remember, extremities ataxia will be there with ipsilateral cerebellar sign. So extremity ataxia means our limb ataxia will be present in the cerebellar hemisphere. Whereas in case of vermis, if you are seeing the lesion in the vermis, they will be having truncal ataxia. Central part of the body will be affected. And classical cerebellar gait we will see is the wide-based gait, right? So now you can see disequilibrium, dyssynergia, lesion of the hemisphere, and vermis, right? When we are talking about dyssynergia, loss of coordination, we are having two important things, dysmetria and dysdiadochokinesia. So what is dysmetria? Dysmetria is called as past pointing, inability to stop a movement at proper place. So they cannot stop. Suppose you are asking a patient to touch this point and touch his nose. So normally what will happen? Directly he will touch his nose like this, right? So that is normal. But inability to stop a movement at a proper place. When we are asking him to touch his nose, he is doing like this, and he is not able to stop it at one proper place, right? So that is why we can say this is called as finger nose test, right? So finger to nose test he cannot perform. So inability to Stop a movement at proper place is called as dysmetria, or also called as past pointing, and this will be done by finger to nose test, which patient cannot perform or difficultly he will be performing. Second is dysdiadochokinesia. What is dysdiadochokinesia or adiadochokinesia? Reduced ability to perform quick alternating movement. So you ask patient to have a rapid pronation and supination. You can see rapid pronation and supination of the forearm. It will be not possible for the patient, and this is called as dysdiadochokinesia. One of the very important topic for the especially for the INICT exam. Keep revising this topic, and my best wishes to all of you.